Hi, my name is Keith, and this is a series of videos about healthy living. And if you like these videos, I ask you to subscribe on this YouTube channel. It does help out in a very big way. This particular video was created on January 7th of 2022 to share information about access to mental health services. The presenters are leaders in mental health services locally and throughout the state of Florida. Thank you.
Our panel members are Dr. Lori Parsons, Director of Lifetime Counseling Center, Mental Health Services, Natalie Hussein, is that right? Yeah. President of the National Alliance on Mental Illness, Belinda Stewart, Communications and Development Manager at 211 Brevard. Going to be talking about 988 dialing code for suicide prevention. Tara Sullivan Larson, Central and Southern Florida Area Director of the American Foundation for Suicide Prevention, and Elizabeth Bublitz, is that right? Yep, you nailed it. Yep, all right. Tobacco Policy Manager, Brevard County, with Tobacco Free Brevard. Almost missed letting somebody in here. All right. And having said that, in that order, I'm going to ask Dr. Lori Parsons to kick us off. So I'm going to not be talking so much anymore. I'll let you guys go with it. So if you would, as close to about 15 minutes as possible.
All right. Sounds great. Well, good morning, everybody. I'm Lori Parsons. I'm the director for Lifetime Counseling Center, and I see several names on here that I am familiar with, and good to see everybody early on a Friday morning. Just to go through some of the questions that Keith wanted us to talk about, the services that we provide. We are an outpatient behavioral health program, and we are a program of the Space Coast Health Foundation and have been since 2017. Very excited to be part of the foundation. The services that we provide are we provide regular outpatient mental health services to anyone who's struggling with any kind of mental health issue. Everything from just adjustment issues and life happening all the way up through some pretty significant difficulties and trauma. We also provide services to folks who are struggling with substance use disorders. We have a number of groups that we provide throughout our offices for both adolescents and adults to address substance use issues. And then our team of folks who provide those services for substance use are all duly qualified to also address mental health issues. So we are one of the few outpatient centers that can address people who have co-occurring disorders. So if somebody is struggling both with maybe depression and struggling with alcohol use or any kind of mental health and substance use issues that are co-occurring, we have a team of folks who can work with them to help address those issues. In addition to that, we have a whole team of folks who work exclusively in the schools, in Brevard Public Schools, all day, every day across the county, working with youth on everything from behavior problems to attention problems to depression and anxiety and other mental health issues. We do a lot of work with trauma, and both with children and with adults. And then we have, in addition to that, a group of folks who do psychological testing. So we can provide that service usually for the courts or for other situations where someone needs some type of psychological testing. The folks that I work with from FIT and supervise can do a variety of different kinds of psychological evaluations for folks. Beyond our clinical, we also are the provider for Healthy Start services for Brevard County. And Healthy Start, many of you are probably familiar with that, but if you're not, Healthy Start is a wonderful home visiting program that is an educational program for women who are pregnant or who have infant children. And our Healthy Start team goes into the home. Obviously, took a break from that and did a lot of virtual for a while with COVID, but we are entering back into homes at this point and providing a variety of information regarding healthy pregnancy, healthy child development, helping people connect to the services that they need to make sure that their child gets the best start in life. So we're excited to have that program with us, and they've been a part of our agency for the past 3 years. Let me think what else in terms of, kind of talking a little bit about services that are lacking in our county. I think one of the things that we all talk about frequently, providers in the county, is that being next to Orange County and Orlando, having a big city nearby us, there are a lot of services that happen in the Orlando area that are not duplicated here in Brevard County. And so it gets a little bit tricky, one of which is, one of the biggest holes that I'm aware of in that continuum of care, is we have a lot of outpatient providers. We have some inpatient providers like Circles of Care and Palm Point, but there's not a lot in between. So if somebody needs partial hospitalization or day treatment or something where they need to come in more frequently, maybe 3 times a week, maybe something that is, they go somewhere every day for some services, without staying over at a residential facility, those kinds of services are really missed in our county. And it's tricky for folks to spend that many days driving back and forth to Orlando. So that's a hole that we have in our continuum. But I think given everything that's been going on with COVID, I think the bigger concern for us as a community right now is less about that particular hole in the continuum of care and more about the fact that the need at this point is overwhelming the amount of resource that we have, even just to provide that outpatient care. Pretty much every provider organization that I'm aware of is kind of bursting at the seams in terms of referrals coming in the door and working really hard to meet needs. Many provider agencies are experiencing having to go to a wait list. And so folks who need services oftentimes have to wait longer than would be preferred to be able to access services. I guess the good news in that is that I'm in a lot of meetings with other provider agencies, mental health providers, substance use treatment providers, and all of us are very committed to addressing crises. So if someone is experiencing a mental health crisis, if someone is feeling suicidal, if someone is experiencing something that is more urgent, we all have means to be able to really kind of bypass that wait list and get services started as quickly as possible, same day, next day, to respond to those immediate crises. We also do have a mobile response team in the county that helps with that piece, and they can respond to crisis situations immediately as well. But generally speaking, that's definitely a concern in our county right now with the impact of COVID, as much as it has obviously created a lot of physical health issues. It has also created significant mental health issues because truly our whole community is being traumatized at the same time going through this pandemic. So it has really kind of created some unprecedented need. In terms of how folks could receive services from our agency, we have a number of different kind of front doors, if you will. People can just give us a call. I will, when I'm done, I'll put a copy of our brochure, a PDF copy of our brochure into the chat so people can grab that if they want to. But you can just call up our front desk and access services that way. Or you can, if you're involved with a referral base, somebody involved in the school, somebody involved with a pediatrician, you can ask for a referral through those individuals as well and be able to access our services that way. I'm trying to be careful about time, so I'll wrap up and make sure that there's enough time for everybody else to say their piece as well.
Thank you, Lori. And, feel free to add information from any of y'all if you have any questions about to Lori to put them in the chat as well. Moving on to, oh, by the way, I should say that, I used to work, it was before it was Lifetime Counseling Center. I used to work for a family counseling center. and many years ago. And the phone number they use is the same number they've had from day one. So should share. Next is on our list is Natalie, and I'll let you take over at this point.
Hey, good morning. I want to say thank you for hosting this, and thank you for inviting NAMI Brevard, which is the National Alliance on Mental Illness. We're a nonprofit. I have essentially 5 volunteers, and presently I'm the chief cook and bottle washer for a lot of it. NAMI is a grassroots organization that was started in the 70s from mothers that had sons that had schizophrenia. And at that time, the medical community, the psychiatric community was blaming the mothers for serious mental illness, such as schizophrenia, and at that time, manic depression, which we call bipolar now. What started out as grassroots in New York is now all over the country. There's 600 groups. You have national NAMI, you have state NAMIs, and then you have individual states has it divided into city or county. We're county. Orlando is big, so they're NAMI Orlando, Jacksonville, Gainesville, et cetera. And what NAMI does nationally is provides education for family members about mental illness symptoms, as well as people who have mental illness symptoms, which we call them peers. And we have emotional support for family members as well, to learn how to speak a different language for someone who is having a brain disorder. People with a brain disorder will perceive vision, or their visual sense differently. They might be more sensitive to sound. They might be having hallucinations, such as conversations or people. It's usually people saying bad things to them, even though there's no one around. We also do, NAMI does legislative advocacy at the national level and state level, and I'm trying to really push for county level to increase funding. We do have, we are partnered with Florida Mental Health Advocacy Coalition in Miami, and they have made some great strides regarding getting funding for mental health conditions in the communities. So what does NAMI Brevard have? What we provide, because we're small, we don't even have an office. I do everything out of my house, and but we're looking for an office. What we do provide is family education classes. These are standardized NAMI taught and trained people who are family members, or they are peers living well with their mental health condition. They take their meds, they have learned skills about how to live with their disorder, their symptoms. They have learned to recognize them and help themselves. So we do family to family starting at the end of this month. That's 8 sessions, 2.5 hours. That is for family members only. We do have twice a month in-person family support group. This is also led by people who are family members. They have either had parents, siblings, or children with a serious mental illness, symptoms, big time symptoms, whether it's psychosis, mania, severe depression, I'm getting lost, abhorrent behavior. And you just come and you be with other people who understand what is going on in your family. A lot of people don't understand what it's like to live with someone with a severe mental illness or severe symptoms, especially if they are not medicated. Every week we have a Zoom call that is at 6 o'clock, and it is for peers. It is run by peers, and people who attend are peers that they can either be symptomatic, medicated or not. It's an hour and a half long. And when my friend Kimberly had told me that with her diagnosis, she was in and out of the psychiatric hospital. She was contemplating suicide at age 48 because no one had explained to her what her disorder was and that she actually could live well, 48 years. And it was when there was a NAMI program that was done by peers at the psych hospital that she was at. She realized that there was help out there, because peers helping peers is, you know, someone who understands it. It's not just a therapist. No offense to the therapist, but it is a bit different. With our website, we do have resources that are national and also for our county to the best of our ability. Anybody can call, they'll get me, they can text, they get me, they email, they can get me. I listen. Sometimes it's frustrating. You have, most of my calls are parents who their adult children are maybe arrested, they're Baker Acted. I deal mostly with the communications for people who have severe mental illness. Not that there's anxiety doesn't affect people's lives, but that's primarily who I deal with in a communication sense. So I try to help them find resources. So what Lori was saying about everything that is sort of lacking in Brevard County, wow, the providers are the biggest. I just called Circles of Care Titusville yesterday to ask, you know, what do they do? Could they, I have questions about people moving out of state who have not made arrangements for their psychiatric prescriptions. And they may or may not have insurance. They may be on another state's insurance, or they're incarcerated and they're planning on getting out. And these are people who their family members are being supportive to them, or they themselves are, you know, being proactive with their condition. And she was telling me that in their office in Titusville, they lost their in-person psychiatrist to go now to a Zoom therapy sessions. And then her clients who come in, they have to come in because they don't have a computer, they don't know how to use a computer, so they can do their Zoom therapies with the physicians. And then she also said that the nurses who normally come and do their once a month injections for long-acting psychotics, they're out with COVID and there's no backup. There's no traveling nurse to come in and do that. So the community services that were supposed to be implemented in the 60s that did eventually go out to the states, you know, but states started cutting budgets, and here we are, you know, 40 years later, we're still dealing with the same lack of community services. Like Lori said, big hole, big hole. I was running through some statistics for Brevard County. We have 615,000 people in Brevard County, and that was in 2020. So if you look at statistics of serious mental illness, 1% of the population in anywhere in the world has schizophrenia. So 1% of 615,000 is 6,000 roughly. We do not have 6,000 beds that between Circles of Care, Palm Point, or the state hospital that can keep people when they are at their sickest. 3% of the population has manic depression. So that's like 12,000 people. You know, people who have psychosis and mania, the medications that they are given takes 3 to 4 weeks to really kick in. And there is no, that's that in between. What we do have available, that from what I understand, with no insurance, you go to Circles of Care. You admit yourself or you are Baker acted to there. The maximum hold is 72 hours. If they can get you stabilized, you will be discharged if you have a place to go. Even if you don't have a place to go, you might be just discharged and you're homeless. Some people who get involved with, because 911 is called, the police come, there is grounds to take them into circles of care called the Baker Act. It's because they are a danger to themselves or they are a danger to someone else. I got a lot of parents, especially elderly parents, that their kids have been living with them, medicated or unmedicated, and now there is some violence going on, and now their kids are in the penal system, no fault of their own. They're just ill and they're unmedicated or not medicated enough. So these are a lot of the phone calls that I get. It's really heartbreaking. Finding adequate or timely psychiatrists once you get out of circles of care is going to be a challenge. You need supportive people around you to remind you to take your meds, to take you to your appointment. But with the HIPAA, they may or may not even know that information because their loved one has the information, but they're still not well enough to understand that they need to depend on other people to have some kind of structure so that they can start getting better with their medications and their appointments. If you come into our county and you try to get an appointment with a psychiatrist, private, that's a long wait. There are Zooms available, might not even be in Brevard County. So that is what Circles of Care is working with. We do have Palm Point, which is, from what I understand, is for people who have insurance, a good facility up in Titusville, and it's relatively new. We have Rockledge Regional Hospital, which does have a psych unit, but if people are really unaware of what is a symptom of mental illness starting with their loved one, I do have some statistics. So 50% of all lifetime mental illnesses begin at around age 14. And 75% of those will be age 24. So a lot of times what we do as humans is we start self-medicating, not realizing that we are having symptoms of mental illness. So you could possibly take medications, or you could possibly take, drink alcohol or do other, like especially marijuana for the symptoms. But now you're looking at possibly putting yourself into psychosis in a more permanent state, or getting addicted, which is now you have the co-occurring morbidities on that. How am I doing on time? Do I have a little bit more?
Couple minutes.
Okay. So I did call our state hospitals. This would be for people in Brevard County who don't have insurance, or they don't have the capability of going to a private psychiatric hospital for a length of time. And there are, between 3 state hospitals, there are 613 beds. But out of those 613 beds, it's divided into 3 populations. You have inpatient psych care, which, from parents that I talk to who have loved ones in circles of care, it's about a 6-month wait list. They're also at the state hospitals, they treat civil and forensic committed individuals. So they have committed crimes, probably something serious. When I had spoken with the sheriff in Orange County, well, he does the Orange County jails, and he deals with the mental health units that they have in their jails, about 40% of their prisoners on average have a serious mental illness. So we have gone from having our loved ones in psychiatric hospitals in the 60s, 70s, and 80s to, as we can all see, they're incarcerated, unmedicated, or they're on the street, and bad things happen to people. Let's see, what else did I want to say? I told myself I don't want to complain. I'm just trying to say that we have some big gaps. So spending in Florida per capita we are one of the lowest spending per person at Brevard County, I think we're probably low also in spending in our county. We don't have enough beds. We don't have intensive outpatient. We don't have enough psychiatrists or nurse practitioners. What we would do well with is when that 988 phone number starts is, yes, 988 is going to be good, but we also need adult mobilization units. We have them up to age 24, but we don't have anything for adults. That would, according to the statistics, once we get the 988 phone number in for mental health crisis working, that's in tandem with 911. And I think somebody's going to be talking about that, that will reduce hospitalizations and incarcerations about 80%. So this is going to be a big savings right there. And how we're going to be paying for it is just through an additional tax on our phone bill, just like we have a tax for 911. The cool thing about 988 is it's going to be used with your geographical area. When I call 211, I have an Ohio cell phone number, so I go up to Ohio, and then they bring me back down to Brevard once I explain where I'm at. I have called 211 just to see. I do tell people to call 211, and there's no offense against 211, but it's a long wait. It's a lot of push this button, push that button. The 988 hopefully will address that, because when someone is in a mental health crisis, they don't have the attention span to wait or even have someone else wait, because there's a lot of too much confusion going on. So
All right.
I hope I was able to explain that. And so what I said, what we do on our website, and people can receive assistance from us, and it's not financial assistance. That's what I have to remind people. Just call, text, email, and because it's just me, I get back usually anytime. I've had calls early in the morning. I've had calls, 1:30 in the morning. So I usually answer because people need help. And my reasoning for getting involved in the National Alliance of Mental Illness is because there is a stigma and discrimination, but we don't understand what mental illness symptoms are. And if someone is having belligerent behavior, aberrant behavior, inappropriate responses, if there's violence involved, people just kick their family members out, and then they don't have to deal with them. And that breaks my heart. So
All right, well,
that
Natalie, I'm
is-
going to interrupt you now.
yeah, I'm finished.
All right, thank you.
Thank
If you have anything else to share with the group, if you would put that in chat, that would be great. If you have any flyers or any other contact information. Actually, this would be a good time to ask everyone to make sure, again, if you haven't done so already, to put your name, your email, and your agency in the chat. So that'd be very helpful. Second thing I wanted to share is she did mention the need for an office. So if anybody here knows about an availability of space for them, that would be great. She did talk about the need for, sometimes the need for insurance. So I put that in the chat. If anybody does need insurance, we have navigators that help people with that. So you can call that number that's in the chat to get access to health insurance coverage. And having said that, the last few comments that Natalie shared were about 211 and 988, and I'm going to shift it over to Belinda. Thank you.
Good morning, everybody. I'm going to be fairly brief because I'm going to talk primarily about 988. But just to start, 211 Brevard is a private nonprofit in Brevard County. We've been doing crisis intervention via phone since 1968. We have been a 211 since 2001 when the Federal Communications Commission approved that dialing code. We were the first in the state of Florida and the 7th in the United States to adopt that. Currently, right now, when you call 211, and I'll share this because of one of the things Natalie said, mental health and crisis is the first prompt on her auto attendant. You press 1. So that is definitely the priority. We do have a long menu of other services we provide, but that is the first one. We received in the past 365 days, I looked this morning, over 60,000 calls. About 7,000 of those are crisis and mental health related. And of the 7,000, about 65% or roughly 2/3 are actually a crisis or suicide intervention. We have seen some increases in those numbers during COVID-19. We do provide the crisis and suicide intervention as a direct service. Many of our other services are referrals. And we refer to quite a few of the folks who are probably on this call, including Lori at Lifetime Counseling Center. All of our specialists are paid staff who are trained in suicide intervention, and we are accredited by the American Association of Suicidology. People ask me frequently if we use volunteers. We do not, because of, quite honestly, the level of training that we believe people need for us to have confidence in them to address the suicide intervention correctly and appropriately. So what's on the horizon for us that Natalie also mentioned is the 988 dialing code. And I am going to attempt here to share my screen. I've got a really short PowerPoint with some information about kind of what we think the impact will be on this. And I'm going to start this off. The 988 dialing code was approved by the FCC in 2018. We and others endorsed just continuing the 211 dialing code. However, the report and the FCC decided on 988. This number actually will go live just in this coming July, so we are now less than 6 months away from that. Nothing is changing for the public here in 211 because of our service via 211. You can dial the Lifeline suicide prevention number will still be active. You can continue here locally to dial 211, but there will be eventually, probably about 6 months in, some significant marketing of the 988 dialing code. We also will answer that here, just as we do currently the suicide prevention Lifeline, and which we have for at least a dozen years, and I think it may be even longer than that. So any of those three numbers will still get you to us and our specialists. The concern that we have are the projected increases that this dialing code may lead to. These are actually, when we first saw these numbers, we were like, this will never happen. And then we started doing some of our own research on what happened with the implementation of the 211 dialing code, some other other factors that were, taken into account to reach these projections. And although the numbers are hard to see here on this, we answer of those 7,000 crisis suicide intervention calls annual that we've had in the past year, about 2,300 of them come to us through the Lifeline currently. This slide just shows the year one projected increases over 800%, bringing the Lifeline directed calls to us at over 20,000 in the first year. And then this is a 5-year projected increase, which puts our annual call volume from 988 at more than our current total call volume. Now, obviously, the challenge for this is to meet that demand. Doesn't do any good to have a simple dialing code if there's no one there to answer it. There are some funding sources in the works. However, there is not a tax on phone service in Florida for 988. That has not been approved. In fact, the state has not identified really any long-term funding source for this, although we are anticipating an increase in funding through DCF, which has supported the planning process for this, and from SAMHSA, the federal agency that will be involved in this. So we will get more money. But that said, you still need people. 211, other nonprofits are not exempt from the current staffing and labor shortage in the market. So we're quite concerned at this point, even with the funding, that we will be able to bring on staff and train them appropriately to meet this demand. Now, when the switch flips on July 16th, it doesn't mean that we're instantly going to get flooded, with 800% more calls. So there will be, obviously, with that, as there is with anything, a slow growth over the course of the year. But that's one of our biggest concerns. We're solely and completely supportive of this 988. It is another way for people to get help when they need it. And so we're definitely an advocate for that. But in addition to the concerns about our own staffing, we also are concerned about the ripple effect on this for the other crisis providers, including mobile response team. Natalie mentioned, that's for 24 and younger right now. It will be expanded in Brevard for Melbourne to adults. There's a grant that has been received, and I'm not sure the timing on that, but that's only obviously one small portion of our county. And then crisis stabilization beds. Even though the majority of our crisis callers do not end up needing to go another step, maybe to mobile response or to a crisis stabilization unit, if you've got an 800% increase, you're going to have a corresponding increase in the number of people who need that additional level of service. And while we can handle the majority of the calls with an effective crisis intervention and follow-up, we do have some concerns about, what do we do with this increase of people coming to us who need more than that. So that's really all I wanted to say. The 988 number is not functional until July 16th, although honestly, if you dial it right now, if I dial it on my phone, my carrier has already implemented that. So as word gets out and people start using it, they will get to the National Suicide Prevention Lifeline that way. Not all carriers have done that as of yet, but July 16th is the official date. So thank you very much for your time this morning. And I'm sure we'll have some time for questions at the end if anyone has any. So thank you very much. And just one moment here, and I will try to figure out how to unshare.
Thank you, Belinda.
Because I've got different things on my screen right now. Okay.
There we go. Yes, thank you, Belinda. And like I said to the others, if you have anything else to share, please put that in the chat. And if anybody has any questions from Belinda, please ask them in the chat.
Okay.
And this is flowing along just fine. I appreciate how things are tying together so well. We'll just move on to Tara now with the American Foundation for Suicide Prevention. Tara, you're up.
Good morning. Thank you, Keith, and thank you to all the panelists and everybody for joining today. I'm honored to be here with you. As Keith said, my name is Tara Sullivan Larson, and I am the Central and Southern Florida Area Director for the American Foundation for Suicide Prevention. So in the state of Florida, we have 6 AFSP chapters, and much like NAMI, we are a very grassroots organization. I am a staff person for AFSP, but I support the work of all of our local chapters, and Brevard County falls within our Central Florida chapter. So I like visuals, so I'm going to share a little PowerPoint screen to go over a little bit about who we are. So our mission is to save lives and bring hope to those affected by suicide. We're the voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy to take action against this leading cause of death. So we are the leading national nonprofit organization dedicated to suicide prevention. We've been sustainable and very fast growing. We're driven by science and evidence-informed research. We engage with those personally affected, either through the loss of a loved one to suicide or those that have a mental health condition, mental health professionals, and community leaders. And we've invested over $30 million each year in research, education, advocacy, and support for those affected by suicide. In the Central Florida area, on an annual basis, we probably invest about $300,000 back into our Central Florida community by way of education and support for survivors. So these are some of our national partnerships that we have that you can kind of see that we partner with in our local communities as well as on the national basis. And here are some more educational partners that we have. You can kind of see those. So why we fight for the cause: suicide is the 10th leading cause of death in the United States, which means over 48,000 Americans die each year by suicide. It's the second leading cause of death for those ages 10 to 34. And it's estimated that suicide deaths and attempts cost about $69 billion in combined work loss and medical costs every year. And it's estimated that there are 25 suicide attempts for each suicide death, which means that about 1 million Americans each year attempt suicide and survive. So this is kind of the suicide rate of the entire country. And as you can see, this is from 2017, so it's a little bit old, but you could see that Florida was right at around the national average rate of 14 suicides per 100,000, which is the way that it is measured. According to most Americans, people feel that suicide is preventable, that our mental health is equally as important as our physical health, and that most Americans would do something if someone close to them was thinking about suicide. So how are we fighting for this cause? So we invest in research, advocacy, prevention education, an interactive screening program through loss and healing programs. And it's all carried out by the work of our chapters, specifically our Central Florida chapter. So I wanted now to switch over and share with you our website so you can learn how you can access some of the information that you can find and get connected with our chapter. So our Central Florida chapter here, afsp.org, and if you put in CFL, it'll bring you to our website, and you can learn how to volunteer, how to find events, programs, and you can get my contact information, and we can work together to request educational programs for your community. So I want to share this. This is what do we do? So we have a program called Healing Conversations, and it's personal support for survivors of suicide loss. And the days and weeks and months following the suicide loss, many people feel isolated and alone in their grief. And we have trained volunteers that will meet with those that request a visit, either in person, by phone, or by Zoom, just to be a listening and supportive ear, somebody who has been there and can offer their words and support to them as they navigate the loss of their loved one. And we have a program called International Survivors of Suicide Loss Day. It's the first Saturday, or the Saturday prior to Thanksgiving each year. And we provide a place for people to gather and to connect with one another. We typically share a documentary, and then we break off into breakout groups by loss so that people can connect with one another in a safe environment. And then although we do not have any AFSP support groups, we do list all of the support groups for survivors of suicide loss on our website. And the way that we help to support these support groups is we offer trainings to facilitators. So we do a support group facilitator training, and we provide resources to those support groups so that they can provide additional assistance to those that are in the groups. So another big thing that several of us have touched on is the need for funding for 988 and crisis response. So AFSP has partnered together with, let me pull it up so that I don't miss anybody, the Florida Mental Health Coalition, which is comprised of all of these organizations that you see here: Florida Behavioral Health Association, NAMI, the Florida Association of Managing Entities, and so on. So we are really dedicated in educating our legislators and lawmakers in understanding the importance of why additional funding is needed for 988. I probably participate in about 5 or 6 different work groups every month that is addressing the need for support for our local crisis centers. So I think that kind of goes to touch on what the challenges are facing Brevard County and many other counties across the state of Florida. And you guys have all touched on it, and that's access to care, affordability, and then when it comes to the crisis units, shorting of staff shortages, and then just underfunding. As Belinda had mentioned, you're expecting to have an increased call volume, and that's going to happen everywhere. And so when those calls aren't answered, they'll then roll over to a backup system, and that could even potentially be out of state. And so, obviously we want to have the resources to be able to handle this call volume in our state, and then additionally beef up our mobile crisis response units that are going out there and making the calls to the homes. So this is something that we are very much dedicated towards and getting additional funding for. I'm going to go back to my thing here. Another thing that is a very important aspect of what we do is bringing prevention education to schools. So if schools request education, we are more than happy with our volunteers to come into the schools and provide training for programs like More Than Sad, which teaches about mental health conditions and how they might present themselves in adolescence. It's got a peer-to-peer component to it where it teaches students how to recognize how the mental health conditions might present themselves in themselves and their peers, and then how to make referrals either by reaching out for yourself, referring a friend, reaching out to a mental health professional. Maybe it's the teacher that intervenes and notices something that's going on in that student's life. And then It's Real. That one is for college age students and can be implemented in the universities. And it just kind of continuation of how do Students that have made that transition from high school to college continue to support their mental health and reach out for help. And then with education, we've seen over the last several years a pretty big increase in the demand for workplace educational programs. And so really through this pandemic, we have been able to connect with more people through virtual programs like the one that we're participating on today. But workplaces are reaching out and having education for their employees that they realize are struggling or might have somebody in their household that is struggling with a mental health condition. So that's a good thing. We provide community education programs open to anybody who wants to learn more about mental health and how to prevent suicide. And just in September of last year, we did a clinician training. That clinician training was open to any mental health professionals for suicide bereavement training. So how do they take care of their patients who have lost a loved one to suicide? And many times they might not get that specific training when they go through their school. And we partnered together with Dr. Jack Jordan to present this training to clinicians so that they're better able to serve those that have lost a loved one to suicide. And again, the support group facilitator training. But to access any of this information about AFSP, you just go to afsp.org. And when you click on the chapter section, you just put your zip code in and you'll be connected with the nearest chapter, which was the Central Florida chapter, and it'll connect you to me. And then when you click on the find support for support groups, all you do is you enter your zip code in here, and then you can put like the search mile radius of how far you're willing to travel for a support group, and you'll find the support group listed nearest to you. So I think I am going to wrap it up and just say thank you for your time this morning.
Great, thank you, Tara. This has all been very helpful, very good information all the way around. Much appreciated. And again, I know I'm repeating myself, but if you have anything else to share to the group, please, Tara, please put that in the chat. Maybe a link to that website would be good. And also, moving on, definitely last on our list, but definitely, not last in terms of information and helpfulness. I'm just going to pass it on to Elizabeth now.
Wonderful. Thank you, Keith. Can you all hear me okay?
Yep.
Wonderful. Okay, I was having trouble with my volume earlier. Yes, once again, my name is Elizabeth Bublitz. I am the Tobacco Policy Manager for Tobacco Free Brevard. We used to be the Brevard Tobacco Initiative, but we just recently went through some changes this past July. And so I'm new, not new to the area, but new to this position. And I also have my lovely counterpart, Lara Figueroa, who's also on this call with us today, just to help provide some more information about Tobacco Free Brevard, the tobacco use and prevalence among those with mental health disorders, as well as talk about how you can get involved and become possibly a member or help with advocacy efforts. So I'm going to share my screen, but once again, thank you, Keith, so much for this opportunity. I'm looking forward to sharing this information with everyone in this group. So let's see here. Okay, you can see that, Keith?
Yes, I had to unmute. There we go.
Perfect. All right. So before we get started, I just wanted to cover just a couple of statistics regarding tobacco use, especially among those who suffer from mental health disorders. So nearly 25% of adults in the United States have a mental health or substance use disorder. And these adults consume about 40% of all cigarettes smoked by adults in the United States. And people with behavioral health conditions die about 5 years earlier than people without such conditions, and more than 50% are related to tobacco-related diseases. So there's definitely an issue there. Individuals who have mood disorders, psychosis, anxiety disorders, developmental disorders, and substance use disorders are more likely to be addicted to nicotine than those without these disorders. And nicotine dependence has proven to be particularly challenging for individuals suffering from psychiatric disorders such as schizophrenia. So a lot of this information I have pulled from the Centers for Disease and Control. I also have a handout that I can provide in the chat box after, but these are just some great little statistics if you need something to reference or want to see where we're currently at with tobacco use. And you can just see here in this graph that any tobacco products is up at 34.6% with those who suffer from mental illness compared to 23.3%. And they also look at regular traditional combustible cigarettes, which is at 30.5% compared to 18.4%, and then cigars as well as smokeless tobacco. So any tobacco products, that's also including your electronic nicotine delivery systems. That's your e-cigarette, your vape pen, your mod. So not just looking at your traditional combustible tobacco products. So many individuals with behavioral health conditions want to quit smoking, but may face extra challenges in successfully quitting and thus may benefit from extra help, which is where we step in. Many people with mental health disorders are more likely to have stressful living conditions, may have low socioeconomic status, lack of access to health insurance, healthcare, and help in quitting. And all of these factors make it extremely challenging to quit using tobacco, especially when tobacco tends to be something that is a vice for stressful situations. And then fewer than half of mental health and substance use disorder treatment facilities in the United States offer evidence-based tobacco cessation treatments. And that is something that we're looking more into and hopefully able to fill this divide. So this is how we go about filling the gaps. So smoking among people with behavioral health conditions can exacerbate symptoms of those conditions. Smoking is also associated with worse symptoms and outcomes among people with behavioral health conditions, including greater depressive symptoms, greater likelihood of psychiatric hospitalization, increased suicidal behavior, and drug and alcohol use relapse. Tobacco use also can reduce the effectiveness of certain medications, and smoking can interact and interfere with psychiatric medications, often resulting in the need for higher medication doses to achieve the same therapeutic benefit. However, growing evidence indicates that quitting smoking has positive effects on its associated improvements with mental health. And quitting smoking does not interfere with behavioral health treatment and does not worsen or impede recovery from substance use disorders. Quitting smoking is associated with a decrease in depression, anxiety, and stress, and can overall increase quality of life. And quitting smoking can also make relapse less likely. Quitting smoking is associated with an increase in long-term abstinence from alcohol and other drugs, and a reduction in substance abuse disorder relapse. And lastly, it has immediate physical health benefits. Quitting smoking dramatically reduces the risk of heart disease, stroke, and cancer. And for example, the risk of heart attack drops sharply just 1 year after quitting smoking. So ways that one can go about quitting smoking is Tobacco Free Florida's Quit Your Way program. We offer tools and resources and services that are proven to help quit smoking. An individual is able to choose any of the tools and or services in a combination to help create and stick to their own quit plan. We have support regarding how to quit vaping or to stop using any tobacco product, as well as the Tobacco Free Florida Quit Your Way program. There's also wonderful resources through the Truth Initiative's Become an X program. And that is a free digital quit smoking platform that offers comprehensive web and mobile tools, including tips and advice through text and email, as well as expert guidance and interactive tools. So there's more than a couple of programs and services that are available. So you can easily just go to quityourway.com or tobaccofreeflorida.com, and they have a whole Quit Your Way section. And one of the neat things about this is that an individual who is looking to quit smoking can get these services such as free nicotine replacement therapies delivered straight to their doorstep. Or if they're looking for something that's a little bit more hands-on, they have the group quit options. Phone Quit, which also is has some great resources for texting support, as well as Web Quit. So they really covered the gamut when it comes to the different interaction levels for those who are looking to quit using tobacco. We also, through Tobacco Free Florida, we have a great new Live Vape Free campaign. This is a self-paced online course that really helps parents and guardians learn about warning signs and facts about vaping. There are downloadable toolkits that are available to help start this conversation with teens. This is a little bit more of a teen-friendly parent education support program. And you can find out more about vapefreelife.com. There's also some text options as well for additional support. And then additionally, I want to highlight another local program. So the ones that we have just covered tend to be all kind of virtual or web-based or through a phone setting. However, here locally, we have our Area Health Education Center, which is also known as AHEC. And they have two types of courses to help individuals quit smoking. There is a single session, which is a one-time meeting, or a multi-session, which is meeting once a week for several weeks, where they provide valuable tools one needs to help quit tobacco. These include preparing to quit tobacco with a quit plan, learning strategies and skills to deal with nicotine cravings to remain tobacco-free, dealing with stressors and ways that you are able to cope when you feel triggered, having the opportunity to share experiences with others in a friendly, respectful, and supportive group setting, as well as free nicotine replacement therapies such as the patch, gum, or lozenge if medically appropriate. You will want to check the website, as some classes have been hindered a little bit because of COVID-19, but I know that they are diligently working at getting these in-person classes back up and running. So that is some great local information that they have across the county. So we talked a little bit about statistics across this population, as well as what we can do to help provide free, quick and easy therapies to help with tobacco use. So I just wanted to talk a little bit more about who we are as a group. So Tobacco Free Brevard, actually, there's myself and Alara in every county, in all 67 counties across the state of Florida. And we actually receive our funding dollars from the Master Settlement Agreement, which was back in the 1990s when Big Tobacco was sued because of what they were doing and who they were marketing to. So those funds from that Master Settlement Agreement was then put into prevention dollars. So for every county, there is a tobacco-free coalition or a tobacco-free partnership. And with that, we really take on the initiatives from our community. We have a meeting every quarter. So our upcoming meeting is actually Wednesday, February 16th at 8:30 a.m. That is virtual. And you can learn about what we're currently doing in Brevard County related to tobacco education, cessation, and policy change. Currently, our initiatives are point of sale. So that is actually how Big Tobacco markets their products at local convenience stores and grocery stores. They have $1 billion budget, and they use that straight to market tobacco products to our teens, especially those that are saturated near and close to schools, playgrounds, areas that are heavily frequented by youth. We work very closely with Brevard County Public Schools to help provide support in any areas that they need with their tobacco free environment policy. We work very closely with our higher education institutions to help them work out policy language or signage or support that they may need across their campuses. We work closely with the Smoke-Free Multi-Unit Housing Initiative. We work closely with apartments or condo associations to provide them with the information and support that they may need if they're looking to go smoke-free, tobacco-free, or if they just need resources there on site, such as those free nicotine replacement therapies. And we also have a youth component, which is our students working against tobacco. We have some programs across a couple of the schools in our county where our youth are engaged at educating their peers on the harmful effects of tobacco products, as well as how we can advocate at a local and state level to make sure that there is change among our community. And last but not least, through the Tobacco Free Brevard Partnership, we are always looking for people who are interested in speaking to our local decision makers to benefit the change of tobacco policy and advocacy efforts. So I'm just going to quickly, I do want to show, it will take me there. So this is our website. So if you wanted to learn more about our initiatives, we do have each of them listed out right here. So you can learn more about each one. If one holds a special place to your heart, we would love to have you join the partnership. It's fairly easy and minimal time commitment, but your impact is greatly appreciated. And I just want to also point out that not only of the initiatives that we have listed are ones that we have to focus on. So if you know that, the lagoon is an important part to our environment here in Brevard County, and you would like to see how we can clean up the lagoons and free of the lagoon and our beaches from tobacco products, that could definitely be an initiative that we bring to the partnership. So just a way to think outside the box and see how we can all collectively work together to end nicotine and tobacco addiction within our Brevard County community. So with that, I do have one question for you all, since we are fairly newer to this role. I'm going to stop sharing my screen real quick. But I am curious, there we go. I am curious to see if anyone, maybe you could put it in the chat box where you can email me directly, but I am curious to see what the issues are for mental health and tobacco cessation services. I worked in a very similar role in Hillsborough County, where we were able to go to certain facilities and have tables on site to educate those who were interested in learning more about tobacco cessation and services that they could get easily provided to them. So that's one area of opportunity. But since we are newer, I just want to know where we're lacking and where we can really step in to help support this wonderful cause, as well as the great work that everyone is doing here in Brevard County. So if you would like to get in touch with me, I put my email in the chat box, but we would love to learn more about the gaps or the roles that we can fill here among our group. So once again, Keith and team and group, thank you so much for your time. I appreciate everyone who's on this call today. And thank you for letting me share our wonderful mission and cause with you all.
Thank you, Elizabeth. Thank you to all of our presenters. Much appreciated. And just want to ask, I'm going to do two things here. I'm going to ask Angelica to see if there's anything in chat that needs to be shared. And then after that, ask if anybody else has anything else they want to add. So Angelica, do we have anything on the chat that you need to share?
So we have just to remind everybody, we have lots of everybody on this call has been sharing their name and their contact email and their organization. I can tell you that the only ask was from Rachel Winston. And she asked if anybody interested in, as part of this call, wants to be part of the school health advisory committee or assist with developing of mental health educational lessons or videos for schools, if they would please reach out to her, and her specific email, winston.rachel@brevardschools.org, is in the chat. So that was kind of the primary ask. Otherwise, there's just a lot of good resource sharing in the chat and kind of people's contact name, numbers, and information. Otherwise, there is no specific questions at this time.
Oh, well, thank you. Rachel, did you want to speak to your comment?
No, there's a lot of information out there, and I think there's a lot of folks in the community, and I'm kind of interested to know maybe if you're seeing an uptick, an increase in self-referrals or referrals of folks because of what we're doing in the schools with the mental health requirement. For anybody that might not know, every school district in the state of Florida is required by state board rule to provide 5 hours of instruction in mental health education, including substance use prevention and suicide prevention and human trafficking. We have a committee that works on the lessons. And so we are always looking for experts and for folks in the field. Lori Parsons came and did some videos for us. And the more we can kind of highlight some experts and share resources with our students, I think the better. I know COVID's been a big part of the mental health issues, but I'm not wondering if the increase in awareness of our students, because they've been receiving these lessons for going on 3 years now, has maybe led to some realizations that some of their struggles may be more mental health than just teenage issues or something else. So yeah, we could always use some. We have school psychologists and school social workers and folks like that who do help on our committee, who are district employees, but folks in the field, if you're willing to do little snippets of video or talk through some stuff with our kids, I'll tell you, they're tired of hearing my voice because I do a lot of the voiceovers and stuff on those videos. I actually got recognized at Starbucks for my voice. The barista at the drive-thru remembered my voice. So to get some new voices on there, yeah, my email's out there. Thank you, Keith, for the opportunity. I know I'm also kind of interested to talk to anyone about, I know there's a shortage in professionals, in psychologists, psychiatrists, mental health counselors, and how can we put together some materials for our students, since we do have those 5 hours, to encourage them potentially to look into those career fields in the future. If they really respond to the lessons and they like helping people or talking to people, that may be a good thing for us to kind of encourage them, especially our juniors and seniors that are thinking about going to college and they've had mental health since 6th grade. By the time they get to junior, senior year of high school, to really look at what are some of those career fields that may help with the labor shortage, as a side note. So thank you, Keith, for the opportunity to speak.
No problem. And started to respond to a chat request. Will the recording be emailed out to the organizations? Yes, just give me some time to go through and do any editing if I need to, because sometimes I start the recording too early and I have to cut off the beginning and that kind of stuff. So once that's done, I'll send it out. A few minutes still. So if there's anybody that would like to share any other information at this time, I do want to mention, I appreciate Tobacco Free Brevard. They are a sponsor for the Mayor's Fitness Challenge. I wanted to add that. And we are partnering also with the Brevard Public Schools with, what's the name of that group?
Learning the ropes.
Learning the ropes. Thank you. Also with the Mayor's Fitness Challenge. So having said that, the next session will be on fitness as it relates to increasing health in Brevard County. And the following one after that, I think is really timely because we have so many pedestrian and bicycle deaths in Brevard County. The following month, we'll be focusing on that. So, so appreciate that. And I'm asking if anybody else has any questions or comments that they'd like to share, certainly do that at this time.